Hey everybody, it's a beautiful fall day here in almost the beginning of October. We've had a rash of lower back problems or lower back pain lately. There we go, we'll get the camera right. We've had a rash of lower back problems lately, and so I wanted to give you 3 things that you could do starting today, right now, that could hopefully help. We would always recommend that you do an exam, x-ray if necessary, but an evaluation with a professional so that they can tell you exactly where. That's going to make a difference as to what exactly you should be doing. But while you're out and doing some raking leaves or walking, I mean, for us in Ohio, this is the best time of year. So, my name is Dr. Brandon Bupp. I'm the owner of the Advanced Health and Wellness Center, and I want to give you some of these exercises. So we're going to walk in here, and Heather is going to try to not hurt herself. So you can go on through there. So we're going to go right over here. And over here to this table. All right, so the first one, many of you have seen us do multiple times before. And so it's pretty simple. Whenever somebody calls me on the weekend and says they have been having some back problems, and I can't see them or I can't get to them, this is the kind of the first one that we have people do, which is just to bring your knees up, bring the knees up and pull into their chest and just kind of hold that position. And really we try to do it, if you can bring that over here a little bit, we try to do it for a minute, at least 30 seconds to a minute, and we're just again squeezing the you could do it this way. It's like a cannonball. Here you can have somebody help you and put their weight on your feet, which pushes your knees into your chest, and again that will take some pressure off of the lower back. The other one that is a big go-to for us is called a pelvic tilt. And so what that means is we tilt the pelvis under. So we're going from here to here, and it's somewhat decompressive for the patient. So we want to go tilt it under and hold that for 10 seconds. Now, again, we can be much more specific if we have an x-ray and there's an evaluation. We give people the option, and there'll be a button here that you can click on this video, or there'll be a link in the comments that you could click to schedule a free consultation and evaluation so that we can give you a more specific idea of what should be done. But there's different things that you would do depending on what the spine looks like that would be specific to the person. Those two are pretty general. So pelvic tilt, under here this way, knees to the chest, okay? The other thing is right leg to left shoulder. So not so much up, although that's not bad, it doesn't have as much of an effect on the lower back. Don't do what I'm doing with your head up like this either, by the way. Relax your neck. So this, we want it to go to the opposite shoulder, and we're going to do the same thing. Relaxing the head, and then we don't want to do a lot of twisting necessarily when we have lower back trouble. Either way, we want to just bring this up here. Again, 45 seconds, and then this over to this direction. Do the same thing. Okay? So we're bringing the knees up. So these are stretches. Again, 45 seconds to a minute. So we have knees to chest, and then right leg, left shoulder, left leg, right shoulder. The pelvic tilt, where we're tilting the pelvis under. And then I'll give you one more thing that generally seems to help people. So that is this child's pose. And you can do it in different ways. So here, we go up, round up, and then sit back and try to reach out. And we're stretching the lower back there. Trying to get a kind of a lengthening or a stretching. The other thing that's good is crawling. So again, there's exercises and a couple stretches that we discussed. The second kind of global thing is typically ice. So if you have lower back pain, icing. And we would do that for 20 minutes at a time, off for an hour. 20 minutes at a time, off for an hour. And I'm not debating the whether it's healing anything or not healing anything. For a lot of people, it feels good. I would stay away from heat, especially if you have an acute lower back issue. And then the third thing is just moving. So if a person is sitting stationary or lying down stationary for a long period of time, that can add to swelling in the joint. The more we're moving, it doesn't have to be advanced or aggressive movements. Walking, elliptical, those things can be good. Acting, doing the hula hoop exercises. I'm not a good hula hooper, I don't think, but doing the hula hoop exercises can be good too. So there's a handful of things you can do. Again, the most important thing, and we want to give you an opportunity to do that, is to be evaluated by an expert. Somebody that deals with lower back problems on a regular daily basis, so we can give you a very specific recommendation. And then again, having some advanced ways to handle those things. So that's it for me today. Hope that helps. Hope you all have a great weekend. Enjoy the great weather and keep your spine healthy. See you later.